Welcome everyone. Today we have another new episode, and this episode actually we're going to discuss about the policy of good health and well-being. We have our panelist, Mr. Rob, Professor Donalds, as well as Dr. William. We have other panelists. They're going to join in a few minutes. I just want to start from Dr. William. What the present situation right now in USA?
Oh, okay. Well, I guess in the health field, two important things. Certainly, the Pfizer vaccines are being distributed. They ran into logistical problems that we believe was caused by poor planning on behalf of the Trump administration, for which, predictably so, they blamed it on the general of the United States Army, who went out front and center and fell on a sword that I don't think was his, because I really don't think that the Army gets planning wrong. Not when it comes to the distribution of vaccines. However, and perhaps Professor Donald can talk more about that particular issue in a moment. Secondarily, though, the second vaccine produced by Moderna has received emergency authorization approval for use, and the shipping for that has begun out of their plants down in the south. I think it's I don't know, Mississippi, Missouri, but I'm sure Donald will correct me when he checks on that as well. Nevertheless, the difference with with the Moderna vaccine is simply this in a nutshell. On the one hand, the benefits are that it can be housed in or refrigerated in just a normal refrigeration unit. That is to say that it doesn't need the extreme cold temperatures in order to survive. The reason why that is significant is simply because it can reach the rural areas that don't have the equipment necessary, like the urban centers do, to house and store the Pfizer vaccines. There is a limitation with the Moderna virus as well, though, and that is that it was only approved for those individuals 18 to, I believe, 65, maybe 18 and up, which means that it's not going to, it can't be administered to anybody under the age of 18 because they simply haven't done any tests given the rapid pace at which these vaccines were developed. In any event, the difference between the two on that point is simply that Pfizer is authorized to administer to 16 to 18, which is an additional 24 months. But that's got to be significant news. However, overall, while it is once again another step forward, they still don't expect to have a sufficient number of vaccines to really do to get to where we need to get. Rather, that's going to be a long-term kind of process. I think by the end of the year, they're forecasting having about 20 million vaccines available. Now, in a population, at least here in the United States, of 330 million, 20 million, you can see if you just do a multiply, if it takes a couple of months at 20 million a shot, we're going to be well into 21, 22 maybe, as the vaccines roll out. However, unlike the dire circumstances prior, it is a step forward, and it's a positive sign for at least the United States. My ultimate concern, though, for our audience and everybody watching around the globe is that there have been a number of emerging reports already that there's a growing black market for the vaccines that are proven, at least around the world, such that developing countries are getting cut out because they simply don't have the monies to buy it. And so therefore, they're just like with anything else, they are referring to or resorting to what I hate to call it because I don't want to minimize it, but knockoff vaccines. That is to say, unproven vaccines, like those vaccines that claim that they are reliable and effective, that have the data for which has not been made public, has not been peer reviewed, and that you really don't know whether or not it's legit. But the poorer nations, in an effort to kind of keep pace, have no other place to turn to. And that suggests really a worldwide question and a global question. I don't necessarily mean to raise our previous discussion with regard to the United Nations, but I think for our purposes here, it's a question that we should all consider and at least cast our opinions on, because quite frankly, our audience is the world's audience. And it's the world people that are concerned precisely about these global issues and the impact that are the ones that are going to at least begin by asking the questions to possibly seek some sort of progress in their own area. So while I certainly appreciate the United States-centric notion of it, I am mindful of the larger global impact. So the United States, it's going to take a little longer, and we're making progress. But sometimes I just think that we focus too much here in the United States rather than looking at the billions of people around the world. I mean, look, there's 1.3 billion in India alone. I mean, that's that's 4 United States all wrapped up. And we're only worried about what's going on in the United States. But with that, I am optimistic. I'm glad to be here on a Monday morning. I did not want to be a Debbie Downer. Let me get Rob and Donald up, because I know that they are up a lot earlier than I am. 3 hours. Yeah, you guys are out on the West Coast, aren't you? Right.
Yes.
That's about
Yes.
7 a.m.
Okay. Thank you, Dr. William. I think we have our panelist, Mr. Rob. I want to start with him, as well as finally, I think Professor Donald can come up with some sort of research and information for our audience. Mr. Rob, what's going on in USA, specifically this vaccine issue? How do you think about these vaccine issues and what will happen?
Well, the United States has a chronic healthcare problem. We pay per capita more than any other nation. We receive in services less than most other nations, almost in line with some third world countries. Mm-hmm. It's an imbalance, and that imbalance is being carried through to during this pandemic, when we don't have enough resources, don't have enough funding, and distribution now has become a problem with regard to the vaccine. Not to mention some of the things we talked about before, the lack of trust in the news services, the overabundance of false information surrounding viruses. The anti-vax group is very large in the United States, and if we don't get to some level of herd immunity, we won't get out of this viral problem. And we have, as you probably know, another supposedly faster moving virus emerging in Great Britain, which undoubtedly will come here. We have not closed our borders to Great Britain, though many of the countries in the EU have done that to date. So we're slow, we're inefficient, we're too expensive, and that's playing out with regard, I think, to the virus distribution. We even in terms of ordering antiviral units, we under-ordered the Pfizer virus antivirus by, I think, if I remember correctly, something around 200 million units. So it's a mess, and we're changing administrations at the moment, which is problematic to begin with. But the existing administration doesn't want to leave, and is cutting off access to the incoming administration, which makes the handoff all that more difficult. So we're going to lose a lot of people here in the U.S. Right now, we're losing at a rate that is unsustainable, up to around 3,000 people per day in terms of deaths, and that's just simply not sustainable long term. So, in a nutshell, the U.S. is not in any way, shape, or form wasn't ready to take on this virus. We've cut a lot of the services and capabilities in terms of fighting viruses. The hope is the new administration comes in and will restore that stuff, but it may be a little too late for this particular viral event.
Mm-hmm. Okay, thank you, Professor Donald. What do you want to add today? Specifically, I think vaccine is a big issue right now.
I want to point out that there is another vaccine, and that has been being distributed equitably throughout the countries in the world, and it came from the UK, and it's a very effective vaccination. The way that it was tested makes it look like it was less effective than the vaccine that we have in the United States. We developed in the United States. It looks like it's 70% effective rather than 95% effective. But they used different criteria rather than just testing people who had it or were going to get it. They looked at a broader scope of people. And so they came out with different results. When they did the test the same way as we do it in the United States, they analyzed the data the same way. It turned out that they were as effective. And they've developed significantly more doses. The Russian vaccine apparently is very effective, and the Chinese vaccine is also effective. The way that they tested it was more opaque. So as Dr. William pointed out, we don't really have the good quality peer review. However, the Chinese, they've got lots of people to test it on. And they don't do it the way we do. They say, you're going to get a shot or we'll sue you. I mean, you know, you're going to get shot one way or the other here, buddy. And so globally, I think there's going to be a lot of vaccine. The United States, as both Rob and Dr. William pointed out, has a very messed up healthcare system. And I hope that we can talk a little bit about that, and not just talking about the United States' messed up healthcare system, but talk a little bit about some of the alternatives and what are being done in other places. Because if you've listened to me in the past, I've been encouraging us or the world to look at the places that are successful and try and copy what people have been doing that's successful. And the United States is not as successful as it could possibly be. There's this whole free market like ethos, laissez-faire medicine, and it doesn't work for a huge number of people. I'm going to say this really quick and then shut up so other people can talk. My wife works at a clinic for, we call it underserved communities. And she's what's called a nurse practitioner in the United States. They act as basically doctors. She can diagnose illnesses, prescribe medicine, you know, do all of the give shots, do all the things that doctors do. I mean, prescribe the shot, not just physically give it, but she can, and even do simple medical procedures, the whole bit. And the people that she works for are mostly migrant farm workers. And they get very, very, very good health care. So it's the way it works in the United States is disconnected, discordant, and complex. And so that's going to be something that we can kind of hold up as and parts of it work and parts of it don't. And so we can hold that up as an example for what developing countries could do that are more effective than what's being done in the United States.
Thank you. One specific point always in my mind, actually, we know US economy is one of the biggest economy. They have more scientists, researchers, doctors, big healthcare system. But in the second wave, we are observing USA is highly affected. What the reason? Is there any scientific issues for weathers or many other things? Example, Malaysia, yes, definitely they are affected, but not like USA. I think every day like 3,000 people died and 1,000 people actually affected by the COVID. It's really I think definitely dangerous. Even they are the big economy, and many developing nations, they have actually dependency with developed nations. What I know, even every aspects like different industrializations, different kind of manufacturing, different kind of things, they have strong engagement and dependency on Europe, on developed nations. What's going on? What's the issues that USA too much of people died? Can you share your experience with our audience?
Well, I can give it a shot. The
Yes.
fact of the matter is that we did not take the virus seriously. The government, anyway, didn't take the virus seriously early on. They believed it was going to go away naturally. They believed it was going to be like the flu. The government's focus appeared to be on trying to maintain the stock market and thus downplay the risk of the virus. And the CDC made an early mistake because they were concerned that we would have shortages of masks. They put out shade on wearing masks. In other words, saying the masks were dangerous and would actually cause you harm. And that was surprisingly effective. It was also a false message. But the fact is the masks did not do you harm, and they were required to remain to reduce the spread of the virus. And once that set in, then you created a dichotomy between people that believed in masks and people that didn't believe in masks, and folks that wanted to adhere to rules and regulations and those that did not. And so we've got a fairly significant rebellion here in the United States with regard to social distancing and mask wearing. And that's contributing to the spread, and it's overwhelming our hospitals. And many of the hotspots right now, they are out of ECU beds, and they're now putting people in parking lots and in temporary facilities and having to rent storage facilities for dead bodies, which is not something the country was set up to do. I'm not sure any country is set up to do. So it was a series of tactical mistakes. It showcases an excess focus on responding tactically to what was a strategic problem. And the end result was a lot of missteps that we're paying for right now, and no real clear path other than delivering the antivirus into getting ahead of the problem. I think most predictions showcase it's going to get a lot worse here before it's going to get better. People continue to gather in large groups, and the Supreme Court just ruled that you are okay to gather in large groups for prayer, and of course that's going to cause the spread to increase. Some of the biggest churches, the mega churches, are continuing to meet in extreme groups, and that's resulting in a lot of spread. In Southern California, for instance, there are a number of mega churches, and I think there's a correlation between that activity and their extreme infection rate in that state. So it's just to be net. It's nobody took this seriously early on. Still not clear the government's taking it as seriously as it should. And being in the midst of an administration change, it just exacerbates the problem, and particularly when one administration doesn't want to leave. So we've got a train wreck here.
Mm-hmm. Thank you. I just want to add one point. Mr. Mikhail, he's our audience. I think you refer few of your friends for joining today's discussion. Thank you for your reference, and you request me, you want to work for World Talent Economy Forums, so you can work as a volunteers. We have very exclusive scientific committee, all of our panelists actually joining as a scientific committee, as well as the young people like you, those who joining in our World Talent Economy Forum as a volunteer. I'm sure you will get your world-class experience from our mentor, from our scientific committee member, from our scientist, and all of the world-class professional, those who are joining today. And beside that, I want to give special thanks to our audience, because I find that many school, college, universities, they already start observing our sessions. Even they are developing different group, and they sharing our content, they sharing World Talent Economy Forums to our audience. Besides that, I want to add one of the exciting information with our honorable panelist. Even today I get call from one of the big corporations, and the corporation said, we want to give you 10,000 laptop to our students, and with these laptops there are all of the World Talent Economy Forums content will be available in these laptops, and students from different developing nations, like 10,000 institutions, will get support from this content. So I'm sure those who joining as a faculty, as a mentors, as a speaker for World Talent Economy Forum, I'm sure billions of people, even in near 2-3 years, you can reach. And I'm really want to give thanks the university, school, college, already many volunteers like Mikhail's, they are already communicating, and they are sharing, and they are distributing our content. So hopefully it will be very interesting, and how you sharing your knowledge with our audience, it's a life-changing, because these people, they never get chance to communicate with you. They never get chance a best faculty like you. They never get chance a best mentor like you. But through this World Talent Economy Forum, I can give you the guarantee that many of the people from around the world, specifically developing nations, those people need your support. Those people need your advice and guidelines. They are actually getting many kind of support from you, and your knowledge is very valuable for World Talent Economy Forums. And I'm happy, but in between 2021, the 10,000 laptop, one of the corporation, they committed to me the 10,000 laptop they will distribute, and our content will be available, and it will be 100% free for the student, both laptop as well as content from World Talent Economy Forums. So I need more of our support from our audience as well as from our speakers.
It is very good to hear. Congratulations to all of the panelists, of course, and to you for bringing us on. I must admit that sharing the software for the mind, a term I coined, long before I called it brain software. Somebody can look up my book a couple of decades ago, maybe more, But things have changed since then, and obviously, today I recognize that the most valuable brain software is the experiences in our life that we take. It is not just the learnings,
Hello.
the
Yes.
academic stuff. It is the experiences that young people can have by participating in this process that we all call living. And that's why I want to stand up, in favor of health, science, and of course, human development, to simply say, we got to go on living. We've dealt with epidemics before. In the 1600s in London, you had the plague every year, for very many years, and you survived that. In the 1940s, we had the bombing bleach from the Hitlerites and the other Nazis and the National Socialists of Germany, and we survived that too. And I must tell you, the people doing the bleach, they did not necessarily all of them wear the helmet that was distributed or the gas mask. And it was actually a very fecund time, because people, they decided that we are either living or dying, and we are going to take the chance and we are going to go on living. And today the same thing goes. We can either, go and hide under the duvet, and allow our country to be destroyed, and we can stay hidden in our bathroom, until the year 2029 or 2031. Or we can take a chance, to go on living and stop pretending, that by hiding away from each other, scaring away like rats in our own private holes, we are going to extend our life. We don't know when we are going to die. We have to deal with cancer and heart disease and all the other afflictions, diabetes, high blood pressure, all of these things that bedevil the American family. We have not gotten, short of them, and thinking that this one thing that kills fewer people than the annual influenza is going to get rid of that. And of course, for the very elderly, this is a very important precaution, since, the vast majority of deaths are above 79 and 80 years old. And that is the key thing. I have given you at the www.beb.mobi a very good statistics on the article behind the last one that you can consult on how this thing, plays out, including 5 important studies, medical studies, that speak against the efficacy of lockdowns. And these are from the Lancet, the New England Journal of Medicine, and on and on and on. So I think we should look at the equation of, do you choose to be a living dead person, or do you choose to be a living person? And that should be a choice left to the individual. And the people who need to be protected, of course, they can sequester themselves. But if we destroy our economies and our countries in favor of these extreme lockdowns, that they actually have no scientific effect whatsoever, then obviously we all lose. So I bring it out there that we have to consider that we got to go on living. And that includes playing with our children, going to the parks, communicating with the people, celebrating Christmas, celebrating New Year, celebrating life.
Okay. I got it.
Thank you.
Alex, how are you doing today? And
yeah, good. Good morning.
Good morning. Welcome. How's the weather?
Yeah, good. Thank you. So if we're gonna get into a debate about opinion, I completely disagree with Dr. Churchill. I've actually studied nuclear, chemical, biological first responder, hazmat first responder. I actually went to Ghana during the peak of the Ebola outbreak. I was, raising the alarm months before even President Obama announced that it was a crisis. When I got there, I was networking with the World Health Organization, the United Nations. There was a lot of major aid organizations that were there in the staging area in Ghana that I had a chance to meet with, Doctors Without Borders. So I've also taken, the EMT course, the Red Cross course. And since I've been doing international disaster relief, I have an extensive background in training with pandemics and epidemics. And so in January 27th, in the very beginning, January 27th, I sat down with the mayor of Santa Cruz, California, and I said, I don't know if you're paying attention to the pandemic or the epidemic that's spreading in Asia, but it is going to be something that you're going to have to deal with. The R0 value was spreading at an exponential rate, and it was jumping. There's no way that you can stop a virus that is spreading when someo's asymptomatic, when it's airborne. There's just no way. You can't stop a virus that's asymptomatic. If people don't have symptoms, you can't backtrace it to find where it's coming from. So the reason why we're having lockdowns is when people aren't wearing face masks, they're not practicing social distancing, they're not washing their hands, they're not staying at home and doing just only going out for necessary travel and chores and errands, that's when the cases spread and the hospitals get overwhelmed. So that's when we choose, or that's when the government then says, okay, too many people are dying. That's when the doctors and nurses beg the government to put down lockdowns because there's no beds. So 5 days ago, there's 3 regions throughout California. The northern region had 30% ICU availability. The Bay Area had 15%. The LA area, the whole Southern California region, and Central California, they both had 2% ICU, which stands for intensive care unit availability. Now, those 2 regions from Central California all the way down has 0% ICU availability. They're treating people in whatever way they can in, you know, the hallways and garages. There's no hospital beds. That's why we went into a lockdown. The reason why that happened is because people chose to go out for Thanksgiving. They didn't practice social distancing. They didn't wear a face mask. They just wanted to do whatever they want. So those people are putting the elderly at risk, people with weakened immune systems and other anomalies that we don't even know about, why people that we don't yet know about. And now the strain's mutating. So lockdowns just help slow the cases so doctors and nurses can get caught up. And I just, it just frustrates me. The people that deny that we're in a pandemic are like global warming deniers, and they frustrate me because it puts lives at risk. People suffer and people lose family members. Unfortunately, this is now the leading cause of death in the United States. It's like, I think it's like 4 times worse than the flu, and it's just more deadly. And now there's mutated strains that are getting people sicker, and we all have to. So if we just hang in there and we just don't do all that, the travel, and we be careful, eventually there'll be solutions like vaccinations and long-term, like maybe medications or naturopathic medicines, but we don't know all of that yet because we're still in the beginning. So if you want to be a statistic and you want to go out and learn the hard way, yeah, you want to jump in. So I don't want to talk about the pandemic. I want to talk about health and wellness, but
No, we're gonna get there. We're gonna get there, Alex.
Yeah.
I just want to go over to Rob because I mean you're absolutely right. At least it seems to me, and I hope our panel can agree that the rise in COVID identification or diagnosis is a leading indicator, and then hospitalizations are also a leading indicator, and rather the deaths are a lagging indicator of what I guess we've seen with Thanksgiving. And I just want to quickly go around very quickly because I want us to get to health and wellness in terms of holistic or however we think about things. But I guess I'll begin with you, Rob, and then I'll go to you, Donald. I'll come to you, Dr. Churchill. But Rob, I mean, do you think that given the lessons that we're now seeing with the equivalent of a 9/11 attack every single day and the number of American lives lost, at least here in the U.S., do you think that's enough of a gut check moment for the rest of the United States to think twice about traveling? Because I've seen some reports saying
apparently not.
Okay, I got you, Alex. Okay, but Rob, apparently I've seen reports that about 84 million people are projected to begin traveling during this week alone. So, Rob, what are you thinking?
Well, it still goes back to the problem we've got with regard to communications from the administration to the people. There's a lot of distrust, and the fact that we've got 2 different news paths, if you will. The right here's one thing, the left here's something else. And if people are consistently told that it's a hoax, that it's just like the flu, that it's part of the U.S. Constitution, which isn't true, then they're going to do what they're going to do, and clearly they're going to do what they're going to do, and so we're going to have another major wave just at the time when hospitals are at capacity. This really isn't a right or left issue. This is a do you want to live or not issue, and when you get spread at this rate, if you don't do something relatively draconian, you're not going to stop it. And the country can't take deaths at this level. I mean, we're losing families now. And so companies cannot survive if they lose 25% of their employees, or 25% of them disabled. We haven't talked at all about the number of people that are surviving the virus, but they end up crippled. Lung transplant with 2 lung transplants I've been familiar with. Those people are done. I mean, they're not going to be able to work for the rest of their lives anymore, and the economic impact on those individuals is going to be extreme. So it's a case where we really, if we're going to fix this at the very start, we've got to create trust between the administration and the people so we can take minimal precautions up front and maybe protect the spread. Social distancing and wearing masks is not a draconian measure. We should be able to do that without much trouble. Yet we're even fighting that, and that's what leads to the shutdowns and the more draconian efforts. I mean, even look at over in Sweden, where they tried to develop herd immunity by not implementing things. Now they're having to shut everything down because the death rates are unsustainable. Science has to lead. You have to be able to trust the information, and people have to step up and do what the government asks you to do, assuming that they're asking you to do something that's reasonable. And that's where it's broken right now.
Okay, because Donald, I want to
let me interject. I mean, I'm sorry to break the news to you. The studies that I bring up on my article at the Bleeding Edge, they are clearly from various journals of medicine, the Lancet, and just go to my article and see. Don't pick and choose, your own studies. Lancet and the New York and the New England Journal of Medicine contain very many studies, and of course a lot of them are conflicting. But there is not a gospel truth that the way that you are suggesting, or the government or anyone else suggests, the dealings with this epidemic, because you happen to believe that we are all somehow first responders. We are not, sir. And the fact of the matter is, whether we live or die, it's very irrelevant to this particular version of virus. Simply, we have thousands of mutations of this virus because that's the life of the virus. It keeps mutating and it becomes more transmittable and transmissible, but at the same time, it loses potency. So the more it spreads out in the population...
Not every time, not all the time, sometimes.
Yes, but listen, in my state alone, we have 75 different strong mutations, and progressively you recognize that they all have lost the potency. And now we have achieved what we call background immunity. I will never say herd immunity because it's a politically charged word, but background immunity has been achieved knowing that more than 90% of the people have been exposed to this. And the leading cause of death is still heart disease and cancer.
No, not
Those
anymore.
are the leading causes.
The stats don't support this.
Now, hang on.
I don't support that.
I understand that, Alex. I'm coming to you, but first we've got to go to Donald. But listen, Donald, I want to ask you this, because I want to pick up where Rob had left off. I certainly understand what Dr. Churchill is saying, but you're out there on the West Coast, certainly more so. But I know that I've seen reports saying that Washington State, which is where Dr. Churchill currently lives in West Seattle, certainly has one of the more aggressive lockdown stances of any states, say, for example, New York City. So they obviously believe what Alex had talked about earlier with regard to mask wearing and lockdowns and social distancing, as well as the empirical scientific evidence showing that what we're seeing now with these unsustainable levels of losses of American lives are going to continue and perhaps explode through after this whole Christmas holiday. Now, Donald, I'd like to know from you, let's leave aside the debate about herd immunity or not herd immunity, because at this point we've got the vaccines on the horizon. And what I'd like us to do is I'd like us to begin to transition away from the old arguments of do you or don't you, because we are where we are right now.
Yep.
But moving forward, how do you think the best way? Is it with the vaccines combined with our current policies of attempting to social distance, mask wearing, washing hands? Should it be more aggressive like they're doing in the United Kingdom, or do you think it's just about right? And then, Alex, I'm going to come to you because I really want to get us into the whole health and wellness thing, the holistic thing, because we're going to deal with some other things. But Donald, please.
Well, I've been posting some articles from Lancet, and I think the thing that Rob said is the most important thing, is that there gets to be an ecosystem of people who oftentimes don't actually even read the articles that they post, or they don't understand them. They look at headlines and they post these articles and claim that they've made some sort of great scientific truth. I haven't been able to read find Dr. Churchill's link, but Dr. Churchill is a very, very good example of somebody who lives in a completely separate information ecosystem than the rest of us. Dr. Churchill has, if you read his website, it is a fanatical, right-wing, anti-government website. It's absolutely laughable.
No, sir, you have no way to
information.
no ad hominem attacks, sir.
No, hang on, Donald, Dr. Churchill.
I'm not talking about him as a
Donald,
person.
please.
I'm talking about the website.
I know,
You
I know.
cannot attack my ideas. You
Gentlemen.
cannot attack my person. You lost the
Okay,
battle.
gentlemen,
Let's keep it
attacking
moving.
your ideas. I am
Gentlemen,
attacking
no,
your
seriously,
ideas.
seriously, Professor
Stick
Donald,
to the idea.
Dr. Churchill, Professor Donald, this is what I'm going to ask of you, both of you, and that is this. Dr. Churchill, please, you can't interrupt. Really, for the sake of a panel discussion. That is just the kind of the basic rules. And we appreciate your knowledge and your input, but please, you have to allow the other guests to do so. Now, Professor Donald, by the same token, if we can kind of keep focused on what we're trying to do here, which is health and wellness and how we move forward rather than looking backwards with regard to stuff, that would be great. I know we've got.
Okay. What I'm trying to say is that there's kind of a deliberate propaganda ecosystem in the United States. And we can study it by not necessarily looking at Dr. Churchill, but one of the things that we've been able to do is to take social network sites and discover that people forward and get their information from various kinds of sources, and that you can separate it into two piles. And the extreme right-wing ecosystem is very self-contained. It doesn't really go out to other places. And the quote left-wing, I think that left is kind of a misnomer because it's so heterogeneous. It's lots of different people with different ideas. It's kind of everybody that isn't in the right-wing ecosystem. And you can actually look at the stuff there and fact check it. Like, for instance, I just put a link to a Lancet article which says exactly the opposite of what Dr. Churchill's saying. So oftentimes there are contradictory things, but it goes back to education. Somehow we have to be able to break up this this ecosystem, like Fox News, Breitbart. Breitbart's the center of it. And so I don't know what, I think that's a huge challenge.
Okay, Alex, can you help us stitch together where we kind of are and where you think we ought to be going with health? Because, I mean, there are a number of things that people around the world can be doing in the meantime, in addition to the basic things, wash hands, distance, masking, to support our immune system and other kinds of things. What are your thoughts on that, Alex?
Okay. So I have a lot of notes right here. I'm just going to read off some of the information that I have, and maybe one of these categories will help take us in a positive direction, because there's different categories and subcategories when it comes to health and wellness, just like a lot of other discussions that we have on this panel. So first, I just want to mention that our surroundings and who we choose to hang out with, where we live, our environment has a profound impact of our health, our life, our prosperity, and our future. So all the little changes that we do to improve our area and our surroundings are very important. So one of the categories that has to do with health is not just diet and exercise and eating, but it's also pollution. There's a lot of different forms of pollution. There's indoor air pollution, and we're exposed to different things with the fibers that come off our carpets, the off-gassing from the paints, certain danders, maybe, in the air from animals. Some people live really close to oil refineries. So there's all kinds of indoor air pollutions that are caused from the environment, and that's a potential category. There's also a lot of developing countries, they cook in their home and they actually light their little stoves with plastic to light the wood before they burn. So that's a whole category. Then there's the food, eating healthy. There's a lot of different ways to eat healthy. There's food pyramids. There's different types of diets. You've probably heard of veganism, vegetarianism. There's the keto diet. There's some people that only eat fish, but not other types of meats. Some people are on more fruits and vegetables, nuts. Some people, like one of my friends, I don't recommend, but he is, because he's kind of skinny, but he just eats like raw everything, like nuts and fruits and vegetables, goes to the farmer's market, and he doesn't cook food or something. So there's a lot of different types of diets, and then you get nutrients from those, and then there's supplements that you can take. So water is another huge category. We had a discussion about water a few days ago, a week ago. Now, when we get water, I'm fortunate that I am on well water where I live in the mountains. I can drink it if I choose to, but I also incorporate distilled water, and distilled water, there's no chemicals, nothing in it because it's steam distilled. And then I supplement my mineral intake with eating healthy and, some vitamins and whatever else. So there's a lot of communities around the world that are recycling the water. So they're drinking their water, the same water from the city. And the downside of that is so many people are taking pharmaceuticals, antidepressants, painkillers, everything. It's going back into the water and back into their system. So that's a concern, to get fresh water. And that also directs us to drinking bottled water, which is also horrible. So drinking good, clean water to purify our system is extremely important. Unfortunately, there are a lot of communities that still put fluoride in their water. In Santa Cruz, this is a whole fluoride-free community. We don't have fluoride in the water here. In the past, we used to put chlorine in the water, but it evaporated too fast. So now we put chloramine, which is also just not good. So there's also different categories when it talks about health. There's your mind, like what you're doing with your mind. There's body and soul. So I don't know as much about the soul aspect of it, if anyone wanted to touch on that, but the mind and body. There's the direction of physical activity, going out, working out, doing cardio. So what that does is it helps alleviate toxins and free radicals from your body, so you're less likely to get cancer. So when you work out, when you exercise, it's just good for your cardiovascular system and your health, and eliminating toxins from your body. There's also the universal health care, and having some sort of health care.
Okay, because Alex, your lists are always so exhaustive. I don't even know we have time to go through.
Cool.
So what I have right now is I have the environment, which is just your physical environment. We also have water, exercise, mind, and soul. So I appreciate that. I'm going to come right back to you, Dr. Churchill. Which one of these areas do you think is the most important, or is of the highest priority for you when it comes to health and wellness as we look around the world?
Thank you, Dr. William. I appreciate your inclusive question. The most important, statistically, globally, let's not focus in our land because it's very contentious. And I would say the whole world, most number one issue is sanitation and clean water. Those two things are the key cornerstones of public health. We have to attend to the sanitation issue for the remaining 5 billion of people on this earth who do not have adequately protective sanitation that in turn pollutes the groundwater and the aquifers from where people receive their water, including the open water streams such as rivers, lakes, etc. So for me, if we look at the problem globally, sanitation is number one. I mean, we have the majority of the people of India, Southeast Asia, and other places still practicing open defecation. And, practicing open defecation, it leads to some extreme issues of health. So I would say sanitation. If we can help with that, and we can manage also to provide clean water, then I come back to my area. In our developed world, and I don't need to speak about Santa Cruz. I think the water of Santa Cruz is heavenly compared to the water of Flint, Michigan, or West Seattle, where I live in the city of Seattle, progressive, wealthy city, that we still have lead leaching into the pipelines, the old pipelines, and eventually the lead, we end up drinking. So I suspect that the solution is sanitation and the delivery of the clean water that we can manage to get in public systems. So we have to invest in public systems more instead of privatizing the water supply by allowing Coca-Cola or any other company to buy up, the fresh water and then bottle it and sell it back to us, at a price that exceeds the cost of gasoline. So again, sanitation, clean water, they're the very basic principles for us being able to thrive and live. The rest will come along, but I fought very hard at the global level at the United Nations, and we won the right to include the access to clean water for every human being on the earth. It's still going to take us 100 years or maybe 200 years.
No, I understand.
It's not happening. It's not happening in my home, and I know it's not happening in the majority of the homes where our 7 billion people, survive and thrive today.
Rob. With same question. Which ones do you rank as the highest of priorities in terms of health and wellness? I mean, you've got the environment, water. There's issues of mental health, sanitation. What items strike you in terms of what we should be looking forward to or thinking about, either here in the United States or globally?
Well, there's a big difference between developed and undeveloped countries. In undeveloped countries, Dr. Churchill is correct. The problem is a lack of clean, potable water, lack of medicine, and an excessive pollution. Often these countries are used as dumping grounds for polluting materials, and it just exacerbates the problem. In the developed world, I think the problem, probably if you would call a priority, probably mental health would be the bigger priority, only because we continue to not take it seriously. I was involved in the post-analysis of Obamacare when it came out and why it was economically unfeasible. And the reason is when they did the models, they assumed that the youth would pay for the health care for the elderly. Mm-hmm. The failure was they didn't take into account mental health, and that the youth was consuming something like 5 to 10x the amount of resources for mental health as the older generations. And so the positive economic model was based on a fallacy, and that fallacy was that young people would consume less medical resources than older people would, and that's why it's not fiscally solid. It's losing so much money. And it was supposed to be at least a balanced medical program, and it's very unbalanced. But it was because the data wasn't analyzed properly, and then they left out an entire segment of analysis. But by the way, it was a relatively interesting discovery because of the nature of the work that went into it. So undeveloped countries, the water, medicine, excessive pollution. Developed countries, I think mental health is the area that's coming forward. And if I were to fix one thing, we go back to what I'd said earlier, and that's we need to be able to trust the information that we're given. If the information stream is contaminated, everything from electing the right person to even getting a medication that works is compromised. And so that goes kind of the heart of all of this is if and there's just so much fake information out there at the moment, driving bad decisions, that if we don't fix that, I'm not sure we will fix anything.
Okay, because listen, actually, Rob, I wanted to drill down on the point that you just made about the utilization of the mental health resources under the Affordable Care Act. And I guess the question is, you say that they didn't take into account. Is the reason that they made that mistake, or that there was an oversight, or however you want to characterize it, obviously without prejudice, is it that we have changed as in terms of our worldview or our culture, in terms of how we look at mental health? Because perhaps in the past it was just swept under the rug, and that now
it still kind of is. So that the nature is we have consistently looked at mental health as something that only the weak have to experience. It's not a problem for the majority of people. It's kind of a fake science, I think, to a lot of folks.
Right.
At the end is as though the reality was it was left out of the calculations for whatever reason, and so the financial model was flawed at the start, and it goes to bias as we look at the technology we're bringing forward to address a lot of these issues. If we can't address the bias and get unbiased data to the decision makers, then bad things are going to happen, whether we're talking about healthcare or war. And so the fixing that becomes the predominant problem. And a lot of governments believe very strongly that people are stupid and they should only receive the information that will result in the behavior they want the people to exhibit. And and tactically that's workable. Strategically, it results in revolts and major problems. Mm-hmm. It's not sustainable.
Okay, and actually, Donald, I'm going to come to you on the question of the information flow. But Rob, I still had one more follow-up question, and that is this: is that if the inherent assumptions, the underlying premises approaching the framing of the mental health issue were misplaced with regard to the young, isn't it also probably true, and I'm making a bit of an assertion here, isn't it also probably true that same miscalculation sweeps through the rest of the population, so that it's not just a newfound issue of the youth, rather that's a pre-existing condition in both the middle age and then senior citizens? Because if we Because if we're just acknowledging it now for the younger generation, it's probably true that it was there all along, and we have generations of people that have just gone undiagnosed. What do you think of that, Rob?
Well, I think that's correct. That we create a negative stigma to mental health. If somebody's going to see a psychiatrist, there must be something inherently wrong with them. That person is untrusted, untrustworthy. They have serious problems. But the same person goes for have their appendix removed or a knee replacement or a hip replacement. No negative stigma. They're fixed up and brought back and can go back to work and back into society. So it really goes, I think, to the negative stigma that goes to any mental health activity where you're thought to be less than if you ask for help. And so those people that need the help often don't get it, or if they do get it, they get it too late. And then we've got the issue, of course, with trying to use medications to address some of the most serious, and some of those medications are addictive and cause secondary problems we're just now wrapping our heads around. So it's an area that deserves a lot more study and focus, mostly though associated with the negative stigma, and see if we can remove it so the people that need help get it timely.
Okay, so Professor Donald, that goes to the issue of information, well, how it's communicated. And I think everybody on this panel can agree that there is a dichotomy with regard, at least here in the United States, with regard to how people receive their media. I mean, you can say generally, although not scientifically, left and right. Or you could also, it's also been often described as an echo chamber or the silo wing, and whether you want to say it's in politics or economics or anything else. But I think that Rob's point was that in this area of health and wellness, it's that the undermining of the trust that we've seen in public institutions over the last, say, 4 years by this past, well, the current but soon to be past administration, that really affects the way people receive their news and who they trust to receive it from. Donald, how do you see approaching, Professor Donald, how do you see approaching that problem and trying to fix that? Or do you think it's just an unretractable problem with regard to balancing out the information flows?
First off, I really want to thank Dr. Churchill for listening and not interrupting. I really appreciate that. Thank you very much. It makes this whole thing much more valuable for everyone.
Thank you, Dr. Moriarty. You be my nemesis. I love you.
Okay, so the work that I do isn't just about information flows. It's a kind of scientific area called economic sociology, where we look at economics as embedded in social structure. In other words, people's obligations to each other, people's norms, all the different kinds of things that people value. For instance, would you take care of your aging parents? Would you help? Even if you couldn't inherit money, would you? Why would you do that? That's not economically reasonable. We don't make all of our decisions based on purely economic things, but yet our whole society and our whole world, when we ask about the world, like what is a success in a country? It's GDP. What's the success in a corporation? It's profit. We've reduced everything to a metric, that's basically damaging the world. And it's based on assumption of atomic individualism, which is the idea that an economic idea that each of us are basically disconnected to each other, and we're living our lives making decisions based on what exactly is best for us at the particular time we're making the decision. And that's not the way we work. It's incorrect. And so there's been a large effort now to try and measure the success of nations and companies and other kinds of things by how they affect the environment, and the general well-being of the citizens within the country. And I put a link here in the thing to the Global Well-Being Index. It's a research that's being done now, where they're looking around at the countries and they're asking the question, well, how well off are the people in the country? Do they get good health care? Do they have good mental health? Do they have some sort of a security and safety net? All of the kinds of things that make it so any particular individual is going to be better off. And there's kind of a pathology in America, which is where the information flow comes in, that people are told over and over and over again that success is something that is completely based on a person's own merit. And I grew up in a house with books completely on every wall in the house, like Dr. William right now. And I was already reading by the time I was 4 years old. And at one time in college, I was tutoring reading, and I went to I got an actual paying job outside of the college tutoring reading to this girl. And I walked in the house and I knew I was doomed because there wasn't a scrap of anything to read. No newspapers, no books, no nothing. And there's been studies that show that somebody like me is exposed to millions of words by the time I'm 3 or 4, whereas people in less privileged areas aren't. They're exposed to a very small number of words. That's part of what Trump's success is that he uses the vocabulary of a 6th grade. And so everyone can understand him. And so basically, if you learn to look at your sources. So as I say, every time I read an article in the newspaper, it'll say, well, this article came from a report by such and such and such and such. Well, I go read the report and I find out if the newspaper article is actually saying what's in the report. A lot of times they don't. I mean, it's like they haven't even read them. They read the headline or completely misunderstood what the report was saying. And I know to do that because I was taught to do that by very good teachers who told me basically not to trust anything. And even when I read these great reports, I still have skepticism. I never know anything. And so it boils down to education, and I think I think that's something we can do.
Okay, Dr. Sharif, we were on the information flow. How are you doing? Welcome back.
Thank you. Sorry about that. Actually, I have few internets and computer related problem. I solved this problem, then I joined. And I find that you are managing this session and it's really interesting. So my job is that all of the intellectual people like you, I will collaborate together and I will explore all of your messages and informations around the world. This is our job.
Then Dr. Sharif, I have a question for you, because I mean, now that I'm just going to take advantage of this small window of opportunity that I have, and that is this: is that at a larger level, at least it seems here, the flow of well, let me try it this way. The question is ultimately going to be about the flow of information and the trust in the government, because obviously here, what we've had that some of the issues with regard to the pandemic and generally with regard to whether it's environmental issues, whether it's clean water, whether it's sustainability in terms of industrial development, or all these things, all tend to boil down to how it's being communicated, whether it's effectively being communicated, and then we see the results across various countries. In some areas, the United States is absolutely just dead last. I mean, we just don't do a very good job. And you began this discussion with how it is that some countries, less developed nations, as people call them generally, are doing better. And in that regard, it struck me that, Malaysia has done a phenomenal job with regard to its early responses to the pandemic. And I'm asking you, do you see a difference from your vantage point in Malaysia, the way the government and society communicates with its people such that they got a better buy-in and participation rate with the procedures, which led ultimately to a lower spread rate and therefore a lower cost of the pandemic than, say, for example, here in the United States? I'm very curious to see how Malaysia did, because Malaysia stands out as one of the countries that has done a much better job. Even assuming for the United States the excuse that we had Trump as president. Sharif?
Okay. One specific point I just want to share with you, that what I understand as I have experience from the Europe, from USA, as well as in Malaysia, like here, like example country like Malaysia, what I want to say, I know that all of the countries, their government and everybody good, but I saw different approach from Malaysian government. If you understand the Malaysian ecosystem, let's say sustainability, what we are discussing, let's focus on water treatment, nuclear energy and other energy things, healthcare system. My observation is that here Malaysia, I want to say that in terms of intellectual ability, maybe Americans are best, maybe from Europe they are the best, but in terms of government policy as well as policy implementations, in that point of view, I'm very honest with you, I feel that Malaysian government has much more active than other countries.
Mhm.
Maybe Malaysian local community, they may do not understand this point, but as I have experience in different country. I can understand country like Bangladesh and India. I can understand the European context. I can understand the American context as well as Malaysian context. They are lucky their political leaders is good. I'm very honest with you. They're
Could
really,
I,
really, like example Mahathir bin Mohamad. I'm personally meet with him, and my observation that Mahathir bin Mohamad applications of this kind of policy, applications like example, they are learning from Japan, they are learning from USA, they are learning from Europe, but in terms of applications, I'm very honest with you, Malaysia definitely best.
Mm.
Yes, sorry,
I'd
Professor.
like to ask one question that's related to this. I know long before COVID, people in Japan and China and other countries would wear masks if they were feeling ill
Sick.
at
Yeah.
all. And so the culture is kind of like kinder to each other in a way, or more sensitive to the needs of other people. So when they were asked to wear masks because of COVID, it was just like, okay, that makes total absolute sense. And people all started doing it. And the numbers are kind of irrefutable. I mean, the United States is by far the worst in the world. And many of the countries where people wore masks, social distance, and I mean, that's just logic. The virus has to get from one person to another in order to spread. And if you make it so that the virus can't get from one person to another, the virus can't live. It just goes away. And in the United States, there's people that are militantly trying to spread the virus. They think it's a valuable thing to do. And so and I'd like to ask you about that. That's the sociology part of it, the idea that we feel obligations to each other.
Yes, definitely. Yes, Professor, I understand, and this is really interesting point in terms of Asia Pacific, because even today I have a meeting with Japan's and few of my friends in different universities. I try to understand what's going on there. Malaysia actually big fan of Mahathir bin Mohamad, actually big fan of Japan. This is the reality. Yes, if you see the policy, they took different, Malaysia and Singapore specifically, they took policy from western part of the world as well as even China and many other countries. They just try to mix this policy, like capitalism and socialism combined. They try to make
I must interject that I have been to the Kuala Lumpur conference of the ASEAN, and they take their cue mostly from Taiwan, which is similarly an island, small country. Japan being a much bigger and wealthier country. I think Malaysia and Singapore, they take their cues mostly from Taiwan, which is a very successful example in this particular case, as well as having good democratic governance.
And definitely one point for Professor Donald, I want to add that Malaysian, if I observe the Malaysian local people, they are very disciplined. I'm very honest with you. They're very disciplined for wearing mask, for managing the lines, for maintaining these things. They're very much of discipline. If you see Japan, if you see Singapore, if you see Malaysia, even example, Taiwan, Vietnam, they're very much of discipline. Example, we saw that USA, many people go for different kind of political activities, these, that's many things happening, and now today 3,000 people is dying, but these things not happening in Malaysia. I think this is major the reason that government cannot do everything, people has to protect themselves. And actually Malaysian people, Singapore people, what I understand, Japanese people, even Chinese people, they are more caring about their health. And this point, I think It's my observation. Maybe I'm correct, maybe I'm wrong, but my observation.
One very little thing. I teach English to quite a few Japanese, so I'm on Skype with Japanese people almost every day, and I totally agree with you. And I also want to say really quickly, the areas are very different. The area where I live in, everyone social distances, and in California we support that. So. Well, California is like a lot of different states, but in coastal California, we support that, and we're pretty disciplined too. But the United States is a big country.
Definitely, you're just a big country.
Yeah. I have a quick question. This is for Alex. I guess it seems to me that there's a bit of a similarity here, and that is this. If you'll just let me lay it out, that in your area of activism, it seems to me. Perhaps oftentimes run into kind of a brick wall when people don't want to hear what you're talking about. And so that becomes and perhaps maybe there are disagreements and discussions because they're like, okay, well, Alex, what planet did you fall off of? And you're like, hey, people, what planet do you guys think you're living on, et cetera, et cetera. And I say that in jest, but I suspect it's probably true. But it seems to me, and I guess the question for you, Alex, is how do you go about trying to, when you feel pushback, how do you change if you do at all, your message or the way you communicate or the way you deliver information in order to most effectively convey that which you believe in and that you think people need to know? Because it seems to me that may be at the root cause of why we have this information disconnect currently, and maybe it's politicized and such. But can you tell us, Alex, how you go about approaching it?
Yes. So while I'm answering that question, Sharif, I sent you an image that's directly related to this question. If you could pull up that image, it's in Facebook Messenger, and then bring it up. So I have taken multiple courses in journalism at the community college here. Again, I've been published more times than I could even mention on major news stations, national news, world news. I've now been in the newspaper 47 times or something. So there's a lot of different forms of information and getting information out, a lot of misinformation. So with what I've learned in the journalism course is just there's misinformation can be really damaging. And as we see, it's caused issues with climate change. It's causing issues with this pandemic. It caused issues with getting Trump into office, with just spreading misinformation. So the image that Sharif is going to pull up, basically, now this could be misinformation, but organization every single year organizes all of these major news sources. Which one's really far to the right? Which one's to the left? Which one's fake news? Which one's real news? Which one's more damaging to our society, less damaging? Which ones are in the middle? So they do MSNBC, NBC, CNN, Fox News, AP, Reuters, NPR, all the major sources were getting news. You can search that by typing news source, bias, media, right, left, and click on Google Images, and it shows this. It's really interesting because there's a lot of as we continue to see all these people believe one thing and the other, it depends on where we get our news source. So from my activism over all the years, I've done a wide range of different things to try to get a message out to people about climate change or global warming over the last 2 decades. I started around 2000, 2002, and then I got an education in it. So out of all those different ways, I've listed it before. So we got the image almost pulled up. This is a really cool image. Now, again, you might not be able to see it on your cell phone screen or your computer screen, but just know that you can Google image search this. And now this might even be misinformation, but it's good to know that everyone has a different place in our society and how we see this. So I don't know how this is calculated, but this was also brought to my attention in my journalism class that I took. So I try to flood our society with the information that I know, basically climate change. So that's why I got the tattoo that says climate emergency. That's why I stamp all of my money, conversations, public speeches, interviews and forums like this. Sometimes I wear a hat or a t-shirt that says something. There's posting on social media,
right
Facebook
now,
groups.
You are not helping your cause. You are dressed like you are in the Arctic and you are in Northern California. You should be dressed up like a surfer, with your socks.
I do everything that I can because you.
No, but I'm saying a picture is worth thousands of words, and you are dressed like you are in Alaska. Is that cold over there in California?
It was 38 degrees, Dr. Churchill, this morning at 9 o'clock in the morning. 38 degrees. Thank you. Yeah, I can see my breath.
And yet
It's cold. So
I suggest you get dressed like a surfer so you can produce the image that it's too hot, too hot, too hot. So you're damaging your cold.
Then you not understand climate change? Yeah, it's cold here. So it's 38 degrees. That has nothing to do with the climate. This is weather. This isn't climate, Dr. Churchill.
I suffer with you. You know, I'm joking.
Okay.
You know.
Okay, cool. So can I please finish my So I was almost done. So there's different ways to reach people, and then we've brought up that word again. Is it cognitive dissonance? And there's different ways to reach people, and then sometimes people like Dr. Churchill, I'll just give up. There's just like no hope. Other people, I try to provide statistics, information. I be patient with them. Sometimes I yell at people like, what? We're in a fucking climate emergency. So there's different ways that I go about it. And as activism, I try all these different methods to effectively reach people. Some of them are more effective than others. Sometimes, again, I need patience. Sometimes I need try to manipulate people. Look, this is why, or provide the information. I mean, most of the time I'm just trying to raise awareness of climate change and global warming. And then I'm trying to apply some of those techniques to raising awareness that we're in a pandemic and people are dying and people are suffering. So, and I think it's like that stupid saying, not one shoe fits all. And not every situation is perfect with everyone. So you have to kind of mix up your techniques. And my goal is usually to reach the most amount of people, the cheapest and most effective way that I can that's effective. And that's why I use mass media and community TV and stuff like that.
Thank you. I highly recommend you should not dress for Alaska when you're in California. That message would be heard better. So, nonetheless, please do not label people as being worthy of giving up. I suspect that we all have different opinions because not that we see different information or news, is that because we are discerning and we have learned. And myself, being the founder of this humble organization called Environmental Parliament, and having battled, tuberculosis for 40 years all over the world with People's Health International, I can assure you, I've seen and I've heard everything from those people who think that the sky is caving in and we are all going to die tomorrow. And I say, forgive me, if you drop from an aeroplane today without deploying your parachute and you hit the splash on the earth and you die, people are still going to say you've got COVID if they find, the existence of the virus, in your bloodstream.
And so see, you're spreading misinformation. You're spreading. I get uncomfortable when you're on this platform spreading misinformation to other people. We're in a pandemic, and a lot of people are suffering. My roommate lost 4 friends. My roommate, people. I know someone else that lost 11 friends, like 11 family and friends. Like, this isn't a joke. You just I'm just not comfortable you spreading misinformation to the viewers here that this pandemic isn't serious. It's just disgusting.
I agree.
Yes.
I totally
I want to
Number one cause of death in the United States today, it's heart disease. Number 2 cause,
it's not
cancer.
anymore. No, COVID's killing more people than heart disease or anything else. It's killing 3,000 to 3,400 people a day.
Dr. Churchill doesn't know the difference between an opinion and scientific fact. He has no respect for science.
Rob.
Yes.
Rob. Thoughts?
Mr. Rob, yes.
What would you like?
Yes. I want to take some question from audience, if you allow me, Dr. William.
Yeah.
That'll work.
Because audience actually observing your show and they have questions. And they have
I had an answer
questions.
to one of the questions if you want me to answer it.
Yes,
I read one of the questions.
Nur Fazrin, why health issues are sometimes related to politics in many countries? Yes, Dr. William. I want to take another question. There are a few questions from audience. Onika Shams, how can underprivileged country improve their health sector? Yes, even I have personal experience, like example, even in Bangladesh and many other countries, lack of proper healthcare system, many people dying, even my family members, they're dying, lack of healthcare system. So that is my objective, that how we can build up hospitals, how we can build up better education systems. So this is the way we can collaborate and other things. So I want to start from Dr. Williams, then Dr. Professor Donalds, then Mr. Alex, then Dr. Churchill, and Mr. Rob. Yes.
Okay, listen, I can answer that question quite simply, and it's this, and this should not be the answer, but in fact, it is the answer, and it's something that that Rob alluded to towards the beginning of the program. The reason why health is intermixed and intertwined with politics is simply because that's where the money is. And then that's where the authority is. And so here in the United States, just to kind of put it in perspective, I think our economy is about it's the world's largest economy. And I think we're at $23 trillion. I think the next closest economy is China. And I think they're like $21 trillion. And then the third largest world economy is somewhere in the low teens. And then the countries cascade down. But I say that to put this in, to put the framework around it this way: that the United States budget, given that we have a $23 trillion economy, the world's largest economy, has the amount of money that we spend on healthcare alone is larger than what nations spend on their entire budget. So that our proportion of the monies that we spend on healthcare, out of the $23 trillion, that money is larger than when you start to go down the list of the economies of all nations. And so when you start talking about that kind of money and that size of wealth, then politicians are going to get involved because people are going to want to seek advantages, either game the system in order to gain benefit, while others are trying to fight the system in order to provide more effective health care. And as Rob pointed out, what that's led to is has caused and resulted in the American healthcare system being singularly, on the one hand, the most overfunded, but by the same token, sometimes, and many would argue reasonably so, the least effective on a dollar per dollar input versus output. And so politics affects it. It's simply because of the sheer amount of money and the infighting that goes back and forth, whether it's the drug companies, whether it's the health providers, right down to whether it's the doctors, whether it's the government. That's why there's just been a huge debate in this country about whether or not we're getting our dollars worth. And it was just the other day we were having a discussion about whether or not the United Nations was being effective in terms of what they were spending their monies on. And I think that that debate often reflects the debate here in the United States in this regard, with regard to healthcare, only because we want, there are those of us that say that we ought to get a bigger bang for our buck. And then there are a bunch of other people that say, no, it's a matter of freedom. And then both sides end up demagoguing the other side and reducing it to these absolute asinine kinds of examples. And at the end of the day, people are dying. And so in that regard, it seems to me that it's going to be a tough road. The Affordable Care Act, which was a great first step, even though it has some fundamental flaws, as Rob alluded to earlier, with regard to the premises and its implementation, with regard to the balance that you need in order to fully fund it. That's all problematic, but at least that's a step in the right direction. But politics is involved because it decides who gets what. At the end of the day, I think it was one of these other panels when there was another guest on that said that at the end of the day, politics is about dickering around about money. And at the end of the day, it's about who is getting what, when, how much, and under what circumstances. And to the extent that there are people that do not have the global good, let alone the national interest at heart, or even their local community at best interest, or the collective at the best interest, at least in terms of the goals, that's where you're always going to have this disparity. And so the notion is, and I know it's Alex and a number of the other guests, it's this idea that we need to change the culture. We need to change how we're looking at things. And it's not a radical idea. And I've said before, it's not this question that we're trying to change the world. What we're trying to do is we're trying to repair the mistakes that our forefathers made with regard to how we're looking at things, that there are a finite amount of resources, that we're better when we look out for everyone else than we are when we're just looking out for ourselves, and create these disparities, which leads to crime and wars and just a whole mess of other things. So at the end of the day, politics is about who gets counted, who doesn't, where the money gets divided, where the resources get allocated, and healthcare, given the amount of money that's involved, is a real problem. And what exacerbates it the most is that in developing nations, or those nations that are not first world nations as they are so defined, it's even more acute because the resources are even less. And so you've got more people fighting over less resources, and that scarcity of resources drives the viciousness with regard to how people engage in the fight, rather than taking a step back. And perhaps this COVID pandemic is something that's caused us to think about it in a different way, that says that we really have to take another look at it. But I'm all for whatever reform Rob has, because don't mind me. But
yes,
that's
Mr. Rob. Yes.
I apologize for going off, but the money's involved.
Okay. Yes, Mr. Rob.
Yes. What was the question?
Sorry, Rob.
So I thought we were going down the what could emerging countries do with regard to healthcare, and at the beginning, when you have a limited budget and you have a need, the start should be to analyze and prioritize that need so you can put money where it will do the most good. Certainly, we've been having a discussion on the side about what's the leading cause of death here in the United States, but one of the things we don't do here in a developed country is we don't actively rank what kills people and then put resources against the problem. We would find if we did rank them that actually death by automobile ranks pretty highly, and yet the efforts to create autonomous cars are not heavily government funded, and we seem to be going down the same traditional paths we have with most of our financial efforts, which means they follow lobbyists and they don't follow the science. And so if you're an emerging country, the best way to address a health problem would be to first analyze what the health problem is and then prioritize the resources you have against the problem. That way you're taking the money you've got and causing it to have the greatest impact against the diseases that you have or the health problems that you have. But it should start by analytics. It shouldn't start with opinion. Yet sadly, in most governments, the opinion drives the decision, not the science. And we do need to fix this. And we certainly need to fix the war on science that's going on right now in a number of countries where we're vilifying the scientists and the doctors and not focusing on the problem and attacking the people. I mean, in some countries, they're taking healthcare workers and they're demonizing them. And these poor people are trying to keep folks alive and they're being treated like criminals. And that's certainly very wrong. So some of the resources you can use, the Gates Foundation is very active in this area. Bill Gates, the amount of false information that survives my old buddy Bill has been just amazing during this pandemic. But he has been focused since the end of the last century on trying to find ways to get medicine and clean water to most of the developed countries. And they're certainly willing to work with, and very data focused, work with countries to help them advance. It's a resource, you might as well use it. But I'd argue start with data, lead to the decision. Don't start with the decision and try to force the data to fix it, because that never ends well.
Thank you. Dr. Churchill.
Thank you.
Yes.
We had a little sidebar going over there, and I try, to speak honestly. I will not tolerate ad hominem attacks from people who are under, some kind of state of mind that requires serious medication. So I caution you that I am here, in defense of the truth, justice, and the way of free expression that science dictates. So people who live in their own bubbles, they can exist that way, but I'm not here, to tell you or to coddle your feelings. The reality exists. Death is our friend. It's in our lives. We are not going to live forever. Not you, not I, not anybody else. This is the reality. Old people die before young people normally. There is injustice when we have to bury our young. I lost a daughter at a young age. I had to bury her, and I felt terribly broken because that is unjust. Old people must die first. Now, if we want to reverse that trend and to have, young people die first, well, that's what happens when we have war. And my position right now, and what my effort is to cut to the chase, is I want to avoid war, because these epidemics and these discombobulations on this earth, of ours and on the political stage, which I see the world from, 10 miles up, looking down, instead of just being lost in the weeds, like a lot of my friends are, including in this panel. I have to caution you that we are going into a time of a new protracted war. And I can tell you right now, because of intelligence restrictions and secrecy acts, where the war is going to be. But if you had eyes and ears to hear it and to understand it, it is coming. And, you can wear all the masks you want, They are not going to protect you from the things that are coming with the war. So the point is that unless you wake up and face a general reality, instead of just being focused on this little sideshow that claims, to be the end of it all, we have lost the game already. So I'm here to tell you that I want to share with you, my goodness, and I will not tolerate, ad hominem attacks by anybody who lives in their own particular bubble under serious medications. So I suspect that if we tolerate each other, if we respect each other, and if we understand that the variance of opinion is not misinformation, but it is what we call parliamentary procedure. We talk, and out of the discussion, the best ideas bubble up. This is the method, both in parliament, in democracies, as well as in every other scientific convention, conference, or summit. If we want to shut the people up, by saying that this is misinformation and you know better, well, you're no scientist, neither you are fit, to be belonging in a parliamentary discussion. So I must say, I had my fill and I enjoyed, all this, but I must refrain, from being willing to tolerate people who call names on each other like they're 3-year-olds, like Donald Trump, and they might be happening, to share the same name. And out of that adversity, we come into a point of intolerance. We have to tolerate each other. We have to respect each other. And that's how we go forward. And that's the number one health issue that we have in the world. If we have an opinion exchange, because opinion that everybody has is the right of the people to express. If we stifle them and we want to shut down the voices that you do not agree, this is totalitarianism. This is what the Nazis did in Germany. So, if you have Alex or anyone, not wishing to hear other people because they label them as misinformation, well, I'm sorry to tell you, my friend, this is what the Nazis did when they were burning the books and they were tossing the professors, from the balconies of the universities. So we escaped that misery. We had to fight, a very serious war, a global war in the 1940s to escape that misery. And we are not going to go back there now in the next war, in the next global war that is happening. And I'm sorry to break the news to you. It is happening. You haven't noticed it, but I suspect that you will be woken up someday and recognize that this epidemic, this pandemic, is a usage of bio-warfare. And, when that dawns on you, then we will have a different discussion. But for today, again, I state the fact that the most important thing we can do for our health is to remain cognizant of the fact that we are each other's keeper. We have to care, along with the medical workers, along with the health workers. We should follow medical advice at all terms. We should follow, our own dictums for good health. But let us establish the norm of what we need. We need clean water, we need clean food, and we need clean air in order to maintain the general public health of the population. Not just our individual care. Our individual care, hopefully, we will have access to healthcare, doctors and nurses, but even if that is missing, the well-being of the person is sound mind, sound body, and a sound soul. And there has to be a balance of all these things, and we should never be prohibited from going out into the park to walk about, to jog, to entertain ourselves, and to breathe the fresh air, or go swimming if you're in a warm climate, or even in the cold. Here in the Pacific Northwest in West Seattle, every Sunday morning and Saturday morning, we have almost 30 swimmers. They go out off of Alki Point and they swim in the cold. And, I see that and I say, it's amazing. These people are crazy. But what they do, they're doing their own exercise to increase their own health for very many reasons. So whatever we can do to increase our personal health, it would reflect in public health. But the most important thing is we should focus our public utilities, and these are the most important systems we have to give us the capacity to have the regulation for clean water, clean food, and clean air. And that has to be a human right. We are still working on establishing the human right of access to clean food and, of course, clean air. That hasn't happened yet globally, but it will. And you can all assist in that effort, and let's make it happen. So I wanted to bless you with this and to wish everybody a very Merry Christmas and Happy New Year and all the good holiday cheer, Happy Hanukkah, and to remind you that I'm here at your service. I stand for you, not against you. Please remember that, Alex, and everyone else who might disagree with some of the ideas we have, but it is the cauldron of ideas. And I will defend to the end of my own life your right to say whatever you wish in freedom, whether it be data-driven, whether it be opinion, but it is your voice. So I will defend your right to speak freely every day until the last breath of my life on this earth. And I hope that you will understand that I don't do that just for you. I do it for my children and for your children.
Right.
So God bless you.
Okay.
Happy holidays. And I shall be seeing you soonest on the next session. I must retire from this meeting, and I want to say thank you very much, and I'll see you soon. Bye-bye.
Okay, thank you. Thank you. Thank you. Yes, Mr. Alex. Mr. Alex.
Yes, to answer that question, the interconnection of politics and health, and I assume this goes for both developing and developed countries around the world. So if you break down our society into different categories, why a politician would be running, they're basically trying to get votes and support to be a politician. So a lot of times when they're running for office, they're trying to convince people why they should be in that political position. So health is one of those leverage points that they can try to convince people to vote for them. So there's different subcategories and aspects of health that they might try to convince people and try to get more votes. Business is another major sector that politicians use to try to get more votes or to try to relate with the people in their community. Education is another one of those. Military is another one of the branches of the spending, how their views on the military and what they're choosing to do with the military and those resources of the community, of the country or the government. Environmental aspect, and then there's social programs, and then social services. That comes into counseling, and there's the direct correlation between, disabilities counseling, women's health services, we have Planned Parenthood, all of those categories. So then there's the infrastructure and public utilities. So to answer that person's question, so health is just one of the main categories that a politician has to leverage people to try to get more votes, and that's where they're going to be spending their attention. And then there's other countries around the world, or some countries that have the universal healthcare that seems to be working. And then there's different programs where there's, I guess, like Medi-Cal and Medicare and certain programs here in the United States. So we didn't talk about, because with health, there's the mind, body, and soul. There's also a category that we didn't go into as much. Dr. Churchill might have just touched upon it. It's fulfillment and purpose. So again, every day there's only 1,440 minutes in every day. There's only so much time. So when you balance your time, who you choose to spend your time with, what you choose to do, if you are going to go clean up trash to, make the world a better place, if you're going to work on your own projects, direct your attention towards your family, your friends, your career, your education, your church, your community, to sports, or playing video games or staring at a wall for the whole day. So there's a different ways to balance your time, and then that's what provides, inspiration, motivation, fulfillment. It makes you feel good about the life that you've created, how you've helped people, animals, the environment, and just to feel good about your life. So there's other aspects we didn't really talk about. Meditation. We didn't really touch upon like yoga. There's other forms of stress relief, stress reduction, going out into nature. Just relaxation, and then just being surrounded by positive influences. All of these can be summarized into just making a good list of things to do and just prioritizing your day, just balancing your time. And throughout your life, you're going to have people, come to this party with me, or let's go to this show, or let's do this, or people offering different things throughout your life. So you have to turn down some opportunities to make sure that you stay with what you know or feel is important to live the life that you want to live and have a good balance. And some people are out of balance because of negative influences, and just trying to get yourself into the best situation and make the best decisions that you can to live a good life. And yeah. That's what I'd like to add.
Thank you, Professor Donald. Professor
Well,
Donald.
The United States has three different healthcare systems. We have a socialist healthcare system, which is the Veterans Administration. It's completely owned by the government, and it's actually vacillates depending on the government, how the government feels at any one time. So surprisingly, under George Bush, it got to be incredibly good again. Wow. and then it's deteriorated significantly under the current regime. We also have a single payer health system called Medicare, which older people over 60 people pay into their whole life, and then when they're 65 they can reap the benefits of basically contributing to this insurance program, a single payer insurance program for older adults. One of the things that is kind of a banner for some politicians is that we want to have Medicare for all. That's one system. And then another system we have is that system is not, it's a hybrid because it only pays 80% of what you need. So most people who have Medicare also have private insurance. The other system is completely private insurance, and that's usually paid for by your employer. So, and if you don't get it through your employer, it's extremely expensive. Maybe right before I got old enough to get Medicare, my insurance payments were about $1,200 a month, which is just insane. Yep. And we can contrast this to countries like France, which is, when you look at the list from the World Health Organization of the countries that have the best health system, France is #1. And they have a hybrid system. A lot of countries have a hybrid system, sort of like where there's a government payer for people who can't afford health insurance, but the corporations and the companies also pay in so that they have a combination of public-private insurance, which is basically what Obamacare was trying to emulate. But there was an aspect of Obamacare called it's too early in the morning, but there was a government insurance aspect of the Obamacare that the Republicans wouldn't let happen. They wouldn't.
So that we don't have to remake the wheel in other countries, specifically on the issues of mental health and long-term effects of this pandemic, as well as the vaccines, because we really don't know what the long-term effects of the vaccines are going to be. In that regard, I, for one, am just optimistic with regard to the conversation. I enjoy this. I enjoy all of you immensely. And, you know, I'd rather go live than under the ground, so I'm just going to get at it again, so don't mind me.
Thank you. Thank you. Thank you. Mr. Rob.
Well, it's certainly been an interesting discussion. We went into some areas that I wasn't really sure we were going to or should have gone into. But in any case, when trying to talk about health and well-being, it really comes down to the balance between government and freedom of the individual. If the individual has the information that they need to make proper decisions and the government is properly funded and focused, then you can have a decent plan. That's not the world we live in. The world we live in is the individuals getting bad information a lot of the time, and governments have agendas that often aren't anything but transparent. And until we can kind of fix that aspect, I'm not sure we can address a lot of these problems. For those that are involved in those problems, I still caution you to focus on the numbers, the science, start with the facts, build to a solution. Don't start with the solution, try to get the facts to fit. We're doing too much of that right now, and it's causing a lot of people to die. And it's creating a very unfortunate environment. So the data is your friend. If the data is not your friend, then fix the data.
Thank you. Thank you. Mr. Alex.
I want to go back to your statement, Sharif. That's incredible that you've reached so many people, and with the laptops and the content. And again, congratulations on your success with this platform and your projects, and continuing to make new connections. I'm continuing to share this content in all the platforms and Facebook groups that I can, continuing to bring the smartest, most intellectual people that I know onto these shows, as I hope other people on this panel or potentially people watching these shows to contact you, Sharif, and then say this person might be a good fit for the show, because the more intellectually stimulating conversations we have and we filter through the misinformation and try to provide good information, we could, because we all got to work together. So again, with health, just what Rob was saying. I do think that it takes not just the government or programs. It also takes individual initiative, taking the time to utilize. If you're watching this, most likely not. Well, okay, you probably have internet, or you may, or I hope you do, to research on the the World Wide Web. Just different some of the subjects that we covered. So taking the individual initiative to learn everything that you can about indoor air pollution, health. There's other categories that we didn't go into, like I try not to ever take pharmaceuticals. We didn't go into the category of not taking drugs. We didn't talk about processed foods and the damage of all the processed foods and the synthetic everything that they throw in food to make more money, and just the benefits of just eating whole foods like I try to do. Try to eat a lot of fruits and vegetables, and take care of my temple, take care of my mind, body, and soul. So the healthier we all are allows us to be stronger, to help other people, to help our family and our friends and the people that we love the most. It allows us to have our mind clear and our focus on the things that we think are important, or the life that we want to create. So again, the individual initiative and being healthy allows us to stay strong and help other people. Another sad and semi-depressing aspect of this is we're entering a very chaotic time when it comes to climate change, ecosystem collapses, and more disasters around the world. So the stronger we are mentally and physically going into this very traumatizing time, as we will continue to see more disasters around the world, the stronger we will be mentally and physically to help ourselves and to help, again, the family and friends and our loved ones. So our individual health is very important, and please take the individual initiative to do what you can to be a healthy person.
Mhm.
So,
Thank you.
thank you.
Thank you, Professor Donald. Thank you, Professor Donald.
I'm not going to go in the place of whether you should take medications or not, because obviously medications like the upcoming vaccine are very, very
yeah.
valuable.
I'm not anti-vax, and antibiotics are very important and they save lives. But there's so many pharmaceuticals that are just unnecessary that you can solve with natural medicines. So
Lipitor
yeah.
and
Right.
others are very, very, very valuable. They save incredible amount of lives.
Right.
I take them because I had AFib and that could cause strokes. But taking, it's a 10 times reduction in my likelihood of getting a stroke if I take Lipitor. So I take it.
Right.
But anyway, yeah, I mean,
thanks for correcting that. We're also in an epidemic here with the opiates. So pharmaceuticals are a huge problem, but then there's good ones too. So thank you for correcting that.
Yeah, I agree. I really agree with him. We're just a total horrible epidemic. What I want to point out as a closing remark is I just read a fascinating article about one of the happiest countries in the world, Denmark. And the countries in the Nordic regions kind of vie for who's the happiest country in the world. They switch off. This year it was Finland, but in a couple of years it might well be Denmark, but sure as heck isn't the United States. And one of the things that they do, and this is just fascinating, is that they actually teach empathy. They start at the kindergarten level, and they've developed psychological methods of teaching people to be more empathetic. I mean, think about that. Because in the end, that's the real problem. We have the resources in the world to be able to increase people's health. And obviously, I mean, I so agree the water is a huge problem because so many kids die of diarrhea and dysentery. It's just terrible. And but the amount of money, like a Rotary Club here in Santa Cruz raised enough money to go to China, and there was this village that people were dying because they were basically washing themselves and their clothes and everything else in the same water they drank from. And so there was a nearby lake, and they built a pipeline from that pure water lake down into this village, and they could drink the water. I mean, it's just a Rotary Club in a teeny little town. They managed to raise enough money to do that. So if you multiply that times the resources, or consider the resources that governments in the developed world have, and the incredible imbalance that we have of what we do with that money, we basically give it to oligarchs, and it's very, very possible to do it. But at the core, it is about empathy. I mean, it's about us like caring for each other. And when I lived in Finland, or even Canada, ask a Canadian, they think Americans are so weird because they believe that investing in the people around them is investing in themselves. And that yet in the United States, there's this ethos where, that I've got to get mine. And so I think that doing things like teaching empathy would be, I mean, it goes back to education, and I know it's possible to do. It's being done all over the world. So I really recommend to everybody in every country, developing or not, to consider. And I want to say one other thing. Governments are at the core ways that we get together so that we can do things that we can't do on our own. Like, no one person can build a road. No one person can develop an educational system. We have to be able to act collaboratively. And that's what governments should be, as a way for us to act collaboratively. And it seems to me that in Malaysia, they're doing that. And in Finland, they're doing that. In countries all over the world, they're doing that. And that boils down to empathy, that we care for each other and we understand how we can work together. And when it comes to mental health, that's absolutely one of the most important things. So learn to care for the people around you and everything.
Mhm. Thank you, everyone, for joining today's sessions. There are a little bit of interruptions and little bit of debate. It's parts of any kind of group discussion. So I am sure that our audience, as well as different peoples, while we sharing our contents, they will enjoy today's sessions. And I request we need a better teamwork. If we can do a good teamwork, then many problems we can solve. And that is the objective of World Talent Economy Forum. That's why I invited all of the talented people in the same place, that we can share our views and we can work as a team. So thank you everyone for your very good contributions. Thank you. Tomorrow we have another session. This week until 20, we have a lot of interesting things, because we are focusing on SDG, Sustainable Development Goals. And if we find any kind of solution, definitely in practical world, not only discussions in the live session, in practical world, we will solve many problems together. Thank you everyone for joining today's session. Thank you. Thank you.
Thank you, Sharif. It's always wonderful to be here.
Thank you. Bye-bye.